Assalamu alaikum. I am Dr. Usman, and today we are going to talk about the gait cycle. Before starting the gait cycle, I must give you a disclaimer that this is quite a complex and difficult topic. So I will try to make it as easy as possible for you, and I will try to break it into simple steps so you are able to grasp the concept. But still, if you need any kind of help, you can ask your respective demonstrator or me. Okay, so let's start. What is gait cycle? So, before understanding the gait cycle, we must know what is the muscle involvement while we are standing still or we are standing relaxed. So, what happened when we are standing relaxed? So, when a person is standing at ease, the feet are slightly apart, as you can see here, and the feet are rotated laterally, and the toes are pointing outwards, as you can see in this picture. So, toes are pointing outward, and the feet are rotated laterally. But the mechanical arrangement of the joints which are present in our body, like hip joint, knee joint, ankle joint, and cervical joints, and all other joints, is such that a minimum of muscular activity is needed. So, while we are standing, we don't use much of our muscles. In the stand easy position, the hip and knee joints are extended, as you can see here. The hip joint and knee joints are extended and they are in their most stable position. And what do I mean by that? There is maximal contact of articular surfaces, the articular surface which is present between the hip and the femur and the tibia, and so on. So they are having the most contact and they are able to bear weight much efficiently. So the least stable joint while we are standing is actually this joint, which is ankle joint. So the ankle joint is a little less stable than hip and knee joint, and the line of gravity, the line of gravity, as you can see here, falls a little bit. It falls a little bit above the knee joint. If you see in this section, above the the ankle joint, so it falls between the two limbs, just anterior to the axis of ankle joint, as you can see here. So as it is present anterior to ankle joint, there may be slight risk of falling forward. Okay, so this slight tendency of falling forward is called forward sway. Sway means like swaying from a main point. So forward sway means falling forward. This tendency must be countered by some muscles which are actually the calf muscles, which will contract and resist this tendency to fall forward. Similarly, the spread of feet, uh, it may increase as they are directed laterally and outward. It may increase the tendency to fall laterally. So that is called lateral sway. So the lateral sway, it is countered by hip abductors, which act through iliotibial tract and resist this tendency to fall towards its lateral side. Okay, so that was all about the relaxed stance. I hope you are able to understand the minimal activity or muscle needed while standing still. So the next thing which we have to discuss is actually the gait cycle. So as you can see here, this is a complete gait cycle. A complete gait cycle can be divided into two phases. One is stance phase, one is stance phase, and the other is swing phase. The stance phase make 60% of the gait cycle, whereas the swing phase makes 40% of the swing cycle. The stance phase start with the heel strike or initial contact, and it ends at the pre-swing or toe off, whereas the swing phase will start at the toe off and it will end when the heel of same foot will be touching the ground, and the cycle will repeat again. So let's start. The first step in the stance phase is actually the heel strike. Okay, when the heel of the foot is touching the ground, the heel strike, as you can see here, is actually the initial contact of foot with the ground. It is very important to note that as the foot is touching the ground, all the weight will be distributed over the foot. And as the weight is being distributed over the foot, the anatomical arches will have an ability to diminish, or the foot may become flat, or there may be some plantar flexion due to the mechanical weight of the body. So, to counteract that and to preserve the longitudinal arches of foot, are intrinsic muscle which are present in the foot and the long tendons of foot, the flexor digitorum brevis and the tibialis anterior will work together to preserve that longitudinal arch. Okay. Moreover, to lower the forefoot to ground, there will be ankle dorsiflexion, a little bit ankle dorsiflexion that will be done by tibialis anterior. Okay. And as the hip and knee are extended, so the extensor of both these regions will be involved here. Mainly the hip extensor, the gluteus maximus, will have the major role during this phase. Okay, so that's what happened in the heel strike. One more important thing to note here is when the heel is when there is initial contact, you can see both the foot are on the ground. As you can see here, this foot and this the heel of one foot and the toes of other foot are on the ground. So both these foot are still bearing weight. So that's why it is called double sport as well. Okay. So this is double sport as both the foot are bearing weight, and it will constitute the 10% of the stance phase, or you can say the gait cycle actually. Okay. So as you can see here, the next step is actually loading response. So as the name suggests, the loading response mean all the weight will be loaded now onto one foot or to the single limb. So the foot must become ready to accept that, and the limb must become ready to accept the whole weight. So what will happen? The to accept weight, the knee extensor like quadricep will be involved here. They will extending the knee and stabilizing it while it is bearing the weight. Moreover, the hip will also have the tendency to tilt toward opposite side. So to stabilize the pelvis, the gluteus medius and gluteus minimus as well as the tensor fascia lata, overall the hip abductors will be working to correct that and to resist that. Similarly, as the weight is being distributed over the foot, The plantar flexion, mechanical excessive plantar flexion will be resisted by the intrinsic muscle of foot, the longitudinal tendons of foot that include the tibialis posterior, a long flexor of digits, and the flexor digitorum brevis. It is important to know that to slow the dorsiflexion and to decelerate our limb, the ankle plantar flexors like triceps suri and soleus and gastrocnemius will be working together to decelerate our limb and make it ready for next uh, phase or for liftoff. Okay, so the next phase after loading response is mid stance. As you can see here, the mid stance, in the mid stance, all the weight is being distributed over the foot, and as you can see here, the hip and the knee joints are fully extended. So to stabilize the pelvis, the same muscles as we have studied earlier, to stabilize the pelvis, the hip abductors, including medius and minimus, will be working. And as the weight is being distributed over the foot to resist uh, plantar flexion, the same muscle, the intrinsic muscle of foot, and long tendons of foot that include flexor digitorum brevis, tibialis posterior, and long flexor of digit will be working as well. Moreover, to slow and to preserve the momentum, the ankle plantar flexors like triceps suri, soleus, and gastrocnemius will be working together as well. And to stabilize knee, as it is fully extended, the quadriceps muscle will be supporting the knee and bearing, helping the limb in bearing the weight. So that was all about the mid stance. Now the next part is terminal stance, or when the heel comes off the ground. The same muscle which were actually helping in stabilizing the limb before, like pelvis stabilizer and the longitudinal arch of foot stabilizer, will be working here as well. But additionally, the main focus will be actually on the triceps suri and gastrocnemius, because they will be uh, helping in the lift off by accelerating the mass and making a mechanical position to help the limb to actually help the heel to actually come off the ground. All other muscles like uh, gluteus medius minimus and intrinsic muscles of foot like adductor hallucis and tibial posterior, all will be working together here as before. The last stage is the pre-swing stage, or toe off stage. So as the name suggests, the toes will be off the ground as well after this stage. So as the mass is being accelerated backward, as the limb is being accelerated backward, the long flexor digits will be working here. The flexor lucis longus, flexor digitorum longus will be working to actually lift the foot from the ground towards backward, and preserve the arches of foot. The same intrinsic muscle like adductor hallucis, tibialis posterior, and long flexors of digits will be working. Moreover, there is one additional thing which has to be achieved here. That is, the thigh should decelerate as well. So the thigh should decelerate and prepare for forward swing or the swing phase, which we will be studying next. So the muscles, the flexors of hip, like iliopsoas and rectus femoris, will be helping in decelerating the thigh, which is moving backward now, to decelerate it, to stop it, and help it to bring forward. So as you can see in this pre-swing or toe off phase, both the foot are touching the ground. So this is also double support phase of the gait cycle, which constitute 10% in this at this time. Okay. So the next phase of the gait cycle is actually the swing phase, which constitute 40% of the gait cycle. So first of all, there is initial swing, then we have mid swing, and the last is the terminal swing when the foot will be touching the ground again. The heel will be touching the ground again. So the initial swing, as we have studied earlier, the thigh muscle has helped in decelerating the back movement of thigh, which was moving back here. Now there will be some muscles, the same muscles actually, they will be now accelerating the thigh in forward direction now, as you can see here. So these muscle include the flexors of hip, which were iliopsoas and rectus femoris. So these muscle will help in forward movement of thigh or forward acceleration of thigh. And to clear the foot from the ground, the ankle dorsiflexor, which were working before, they will be working here as well. The tibialis anterior will be working to clear the foot off the ground. The next phase, which is mid phase, mid swing, is actually when the foot is not touching the ground. When the foot is not touching the ground and the foot is in the mid air, so that in during that the ankle dorsiflexor will be working to dorsiflex the ankle to keep it dorsiflex, so it is not loose or does not touch the ground. The tibialis anterior will be playing the main part here. Now the next and last phase of swing phase is terminal swing. The terminal swing is actually, as the name suggests, uh, will be termination of swing, and to terminate the swing, the thigh has to first decelerate, as it was accelerating first. Now it has to stop, and as the flexors of hip are working to accelerate it, the opposite uh, the opposite group of muscles like hip extensors, like gluteus maximus and hamstrings, will help in deceleration or stopping the thigh to counteract the action of flexors of hip. And the leg will be decelerated as well through the help of hamstrings muscle, which are knee flexors. Okay, and to position the foot, the ankle uh, dorsiflexion have to be continued, and that will be done by tibialis anterior. And in that dorsiflexion phase, the knee will extend, and the toe, the heel of the foot will be touching the ground as the knee is extended, and the length of limb is being maintained again, which was shortened during the mid swing uh, with the help of ankle dorsiflexors and flexors of hip and knee. So the knee will be extended to place foot and prepare for contact. The knee extensors quadriceps will be playing the major role here, and this will conclude our terminal phase and the swing phase. And these phases, the initial, mid swing, and terminal phase, are also single sport phase, as the foot is in the mid air and is not touching the ground. So one foot is in the mid air and all the weight is being bared by one limb only. Similarly, the loading phase, the mid stance phase, are also, uh, as well as the terminal stance phase, are all single sport phases in which only one limb will be bearing the whole weight of the book. So that was actually the gait cycle. Now I will show you a little animation to help you understand the involvement of different group of muscles during different phases of walking. So s- I hope you are able to understand through this lecture or through that animation that what are different groups of muscle which are involved at different phases of walking. So see that animation, and until next time, stay safe and stay home. So this is a very good animation of a 3D model who is walking, and the involvement of a different muscle in different phases of the walking. The muscles which are being which are luminant shows the involvement of that muscle during that phase of walking, and the bars which are uh, increasing and decreasing on the both sides are actually the involvement of the contraction of or the strength of involvement of those muscles during that phase of walking. So it is a good animation to see and remember.